Welcome to Thursday Thought Leaders with Dipanjan on VW Healthcare World. My guest today is Mr. Dipanjan Basu, who's the co-founder and partner of Fireside Ventures. With over 2 decades of experience in investing, e-commerce, consumer brands, mergers and acquisitions, digital consulting, he's someone who's deeply involved in the working with disruptive brands such as the Sleep Company, the Fable Streets, Server Yoga, and Nat Habit. So welcome to Thursday Thought Leaders, Dipanjan. You know, let us begin with trying to understand what do you think about the healthcare industry? What do you think is the healthcare story and how it is unfolding in India?
Sure. No, and first of all, thank you very much, Abhidat, for making me part of this, and good morning to everyone. So I'll step back, Arvinder, and a little bit talk about how, as a consumer fund, we got our insights on how the consumer wellness healthcare industry, as you may call it, and you would know the data points better than myself, that if you see a developed country like US, healthcare spends is about anything between 17-18% of the GDP, right? And there was a very recent Lancet report which was debatable, which talks about Indian healthcare spends to be about 1.5 to 2. I mean, 1.5% is what the report said. Government said it's about 2.5%. So irrespective, it is anything between 2 to 3% at best. And even if you take private spending, at best, we are talking about a 3-4% spend on anything on health related, so far as India is concerned. And various countries have seen this changing as GDP per capita rises. So China, for example, is something in the range of 8 to 10%. If you see countries like Singapore is about 6 to 7%. It is just sufficient to say that the headroom, and as India develops, as the GDP increases, GDP per capita increases, there is going to be a very, very heavy increase in spends on health. Now, as we see health, it is, it can be broken down into multiple bucket. So you see there is a preventive and a, let's say, casual health or wellness, as you call it. Then there is an acute health, health, and then there is, let's say, more the classic infrastructure of healthcare, right? Which is around hospitals and primary care and secondary care and so on and so forth. Right? And the spends and the problem which India has today is across all these three, because on one hand, we need, with the growing population, with the affordability, the access to healthcare is not enough. So there is a huge opportunity of access to healthcare, access to pharma, more primary health centers, across the length and breadth of India. Then if you come to non-hospital care, or whatever you call it, like, let's say in the wellness world, that is where we play. We don't invest in hospitals and infrastructure. So that broadly has two parts. And you think about, the top 8 to 9 possible diseases or chronic diseases which any country has, and India is no different, right? So you talk about obesity, sleep disorder, mental health, diabetes, women hygiene, so and I have some interesting data point which I can share. But these are all areas where there are not only access issue, but is also an innovation gap. There are no products, there are no solutions for this for an average Indian. You look west, you see developed countries, you see for every of these solutions, there is a product, and that's where really the gap is. Now, if I do convert that into numbers and say, India at 2030, we will be 5 to 7 trillion, depending upon how we grow in the next 6-7 years. But the GDP per capita contribution of healthcare will increase. So say it's something like 5 to 6%, right? Then we are talking about close to $250-300 billion of healthcare investments, and out of which our estimate is there will be 40 billion to 50 billion online spends, about 100 billion of spends on this whole aspects of consumer health, as we call it, right? Or which including how do I solve your diabetes, and this is actually solving a problem. This is just not having a nutraceutical bar or a protein bar. This is not FMCG. This is this is real problem solving solutions. So for example, in our own portfolio, we have companies like Gynoveda, which is solving fertility, right? They are women hygiene problems. So they are saying, hey, there is a new age way which understands your body. There's a tech involved, there's a data involved, and then there is a product involved which can actually help you conceive better. We have a company called Traya, which is in the hair health solution, right? Which again uses different body vitals to understand your unique reasons of why your hair fall is happening, and therefore solving for it. So in nutshell, Harvinder, I would define saying health care in India will generally have many different areas of growth opportunity, from access to solutions to innovation. We are, of course, as a fund, focusing on the solution and the and the non-infrastructure aspect of healthcare, and India being very low on insurance, unlike US where a lot of healthcare spends on insurance. We are seeing a lot of innovation happening at home solutions for helping different chronic diseases, and that is could be a very large spend, upwards of anything between $40 billion to $100 billion, depending upon how you cut it, from online to omni-channel, and that is an exciting market to go after.
So Dipanjan, also when we look at the kind of companies that you invested in, they are mostly consumer healthcare backed by tech. So like Traya, the Good Bug, Amaha, all these companies that you have backed are consumer-led and tech-led.
Yes.
But there's a lot of opportunity of growth when it comes to infrastructure as well. Because when you look at diabetes or when you look at certain conditions, there's only that much that tech can do. It
Correct.
Can tell you what to do, but it can't go on a walk on your behalf.
Correct.
So there's a lot of on-ground opportunities that are there. Are you as an organization keen, or do you even look at businesses in healthcare that may not be purely technology-led?
Yeah.
How does it align with your overall investment strategies?
Yeah. So I would say, look, technology over a period of time, no matter how you define it, is becoming table stakes and hygiene, right? It's eventually the way I would say that what we are looking for is a solution, right? And not all solutions need to be. I mean, there will be various degree of tech involved depending upon what the solution is. So the way I would say is that, like, we are not investing in classic primary healthcare setups or hospitals, because that's also a big growing need, right? There are not enough primary healthcare centers across India, right? There are not enough doctors across India. So I think that is a larger infrastructure problem, which I think there will be a lot of government spending. And then there are digital infrastructure around it, like Aadhaar, like how UPIization has happened in financial industry. There is going to be a equivalent of that, Aadhaarization or whatever you call it, will happen in the healthcare, which is connected records, which is connected systems. So for now, Harvinder, we are, as a fund, we are not looking at investing in the infrastructure development of the healthcare architecture, which is already happening and is going to only grow. What we are investing is in the solution side of it, and there I would say we are not limited to online or tech or or one business model, and more we are seeing that the business models are converging. So for example, Gynoveda, which started off as an online tech enabled health focusing on women hygiene, it has now emerged as a solution provider and a platform which uses tech, uses data, uses a lot of consumer insights, but also has physical centers, where there is a physical touch point between the consumer and the organization, where the solution of how your fertility gap, for a couple or for a woman, what are your health reasons for not being able to conceive, and what is the path to it. Similarly, Traya, if not today, will at some point have clinics called hair clinics, right? So Amaha is actually already a clinic first business model, right, where of course it uses data, and I like the way you described earlier that India is led by doctors. The doctors brand sometimes becomes higher. So a platform like Amaha would try to do differently to say, hey, the platform is the solution provider, right? Yes, there are doctors, there are psychologists, there are therapists, but eventually your trust is with the brand Amaha. The trust is not with Dr. ABCD, and I think that's the change. That's the change which we are seeing on the ground where health platforms are taking, and we are interested in this, excited about this part of the solution, part of the business.
And what do you think? I mean, you've touched upon hair, you've touched upon fertility. Uh, what are the emerging sectors within healthcare that you're keeping a close eye on? Uh, do you see a potential where there's a disruptive innovation that may happen in certain areas which have not yet been touched?
Absolutely, and I'll just read out some numbers for you, which could be very interesting and fascinating. And these are all the areas we are very actively looking for those solutions, and we think that there are no solutions apart from the ones which were already invested, right? So, as I said, gut health we feel is a very very undisrupted area. Nobody's even understood the microbiomes inside our gut, what it does to our body, and there's a lot of science behind how Indian gut is, and therefore what solutions for long-term digestive health. And digestive health leads to different related. Heart and cancer, I'm not even going there because those are global problems. India is no different. But apart from these large ones, right? So if you see some of the data points, so India has about 430 million obese people, right? So there is obesity, weight loss. Maybe US as a percentage is worse, but as a growing economy, this is becoming a big challenge. So that is a big focus of area. Reproductive health, right? Both men and women is a very very growing area. The childbirth issues, the marriage age is getting pushed out. So we are starting to get those classic developing, I mean, especially in the metros, and very soon it will catch up with the rest of the country. So reproductive health and sexual health are very very large large problems. Sleep disorder, 76 million people India has recorded some sort of sleep disorders, which eventually leads to different diseases and so on and so forth. There are 80 million people with serious mental health issues, right? And this is not these are not talking about teenagers who are anxious, but these are people who have actively looked out for solutions, online and offline, where they are going through serious anxieties. And sleep disorder and mental health are also correlated. Respiratory disorders, right? I mean, every city in in India, whether it is Bangalore, Delhi, there are various aspects of pollution levels, pollen levels. So, including kids have serious level of respiratory challenges, and even as a percentage, it might look small, but when you put absolute numbers, given the size of our country, it's a very very large problem, right? Kids in general across diseases, kids health itself is a big area, right? In fact, I was reading very somewhere recently that GDP per capita and height of the country has a correlation, right? And and if you see south country like South Korea and India were similar height, I think 20-25 years back when South Korea was developing, and today an average height of a South Korean is higher than India, a lot taller than India, right? So kids physical health itself is a big area. India has about close to 130 million menopausal women, right? There are various solutions which are possible to help those conditions which are today not there. Pain management, right? Osteoporosis, there are 100 million people who have some or other, and this is where the senior care part of comes in, right? As India age, right, there are no solutions for seniors, 40 plus, 50 plus. I mean, I'm not even going to trends in US and globally where people are talking about age reversal and long-term vitality. These are like, I think, something maybe 5, 7, 10 years out, but just simple, bone health or calcium deficiency or whatever you call it, both in adults and maybe more acute in older people. So these are some of the areas where, and hair, as diabetes, hair, something which we always, are common problems. So if you cut this across, you see there are at least 10 to 12 these chronic lifestyle diseases. These are, a lot of it is lifestyle. right? And of course, a lot of this leads to, conditions like cancer, heart diseases, and so on and so forth. And there is an acute part of these diseases, and then there is a lighter part of the disease. And therefore, we are saying that, hey, can there be a platform which understands proactively what diseases you're likely to have given your lifestyle, given your conditions, genetical health, etc., and therefore give a solution across these. And we don't see this is one platform which can solve all of this. So we are seeing separate platforms for each of these, and therefore we believe that this is a very, very large opportunity. But the bar of innovation is very high, right? It is not like the consumer product FMCG, companies where we have seen that there's a white space, there's a good innovation. The innovation cannot be good; it has to be the best. And interestingly, Arvinder, that is the silver lining, right? We used to always see US as the hub for innovation in medical science, right? Though it is though Indians doing it, but we are seeing that reverse talent flow, where the number of patents filed are going up. Like, so there's a 25% increase in patent files in the whole, medical world. And we are seeing entrepreneurs who understand this place are building it from India, right? So very, very interesting trend. But these are the spaces, we think are very interesting.
The nail, because with the increase in patents that we are seeing in healthcare specifically, one of the questions that you've been in the startup space and you've been dealing with a lot of startups, you would know that one of the questions that we had always been dwelling upon was that why isn't disruption or innovation coming out of India? We are very good in creating B2 products, but I think healthcare has changed that paradigm. And today, I think probably it's also because of the uniqueness of our country, how diverse we are, how widely spread we are, and that has led to inequality of healthcare and its healthcare delivery as well, where you have urban areas which are having the world class, if not better, healthcare. But if you go down 200 kilometers to the interiors, they don't even have the basic healthcare.
Yeah, absolutely, absolutely.
And I think technology is changing or bridging that gap. But since we were talking of proactive approach, you used this word. We are, as a nation, also looking at preventive healthcare because and one of the things that technology has done, whether we look at genomics, etc., it has brought forth the concept of predictability. And because of predictability, we are able to proactively work on preventing a disease rather than trying to cure it.
Yeah.
And one of the areas that is also emerging, or surfacing now is the mental health.
Yes.
So how are you addressing preventive concepts and businesses that are looking at solving the mental health issues? Because the metric of success there is very subjective. There is no, numbers that you can say that, now we are saying that, the person is feeling better. So how do you choose, what is your criteria to evaluate such businesses that may not have a very clear metric of success?
Yeah. No, that's a very, very interesting question, Harvinder. And in fact, we come across this question pretty much in every particular investment that we evaluate. So in all these areas which I laid out, or including the ones which we have done, right? I think our learning is that, there is so let's take diabetes as an example, right? I think 1 out of 3 Indians have diabetes, right? So it's the quantum of the issue is not there, right? But I think the India is still at that economic level where it's pure preventive, right? Where let's say you diabetes is bad, you're likely to have diabetes. But if you're not suffering, and that's the definition, we call it as acute, right? So when you say acute, which means there's something which is troubling you, you may not be like a very heavy sufferer. So there is a light sufferer, acute sufferer, and a heavy sufferer, right? If you break the market into these three, right? Technically, let's say something like diabetes, even gut health, right? Any Indian, any of us at any point of time will have some digestive disorder, right? But that is a light sufferer, right? Then there is an acute sufferer who is saying that, it's a very high recurring problem for me. And a heavy sufferer is actually who is going to hospitals and doctors and all that, right? So we are saying in these first two categories, and I'll come to the mental health question specifically, which is even more trickier. But even in general health, we are seeing the adoption of the consumer who is just pure light sufferer actually is still low, right? Because there is general of awareness and they believe that, hey, by doing some exercise, it will be fine, or going for a walk, it will be better. They are not adopting to solutions yet, unless the markers come to a level where they find, hey, I can't, cannot stop anymore, right? So I think that's where we see that the businesses are first getting built who are solving for the acute, and as and when these business start with the acute, that platform then becomes a content and a mechanism to even educate customers and say, hey, like Traya has already started to do, saying that the consumers of Traya is people who are suffering with hair loss, right? But now they started to talk about saying how to prevent hair fall, right? How you don't have to come to me eventually, right? If you do certain things. But I think it's a journey, because just a general, I'll give you an example. We had invested in a company called Sarva Yoga, which is a yoga platform. And look, I mean, philosophically, yoga can solve any health problem in the world, right? You ask any Indian, the answer would be yes, I know yoga can solve. But when it comes to monetizing, saying, hey, will you do yoga to reduce your diabetes? There is a solution, but the consumer would not take it, right? We'll say, or I mean, I do yoga because, let's say, it's general fitness, and therefore the monetization and the success of those businesses are lower today, because the stickiness of the consumer for a particular solution is not there. But the stickiness of a consumer for a solution like Amaha or for a Thrive is very high, because they are suffering, right? And for when you're suffering, you need a solution which is solving it. And if you're able to show that it is solving, then it works. So that is something which we have seen as a learning, that India is at a stage where the platforms which are solving for self-care but acute problems, right? But has not become so grave that that you need to go to the hospital. That's the big opportunity. That's the belly of the market. As and when we progress, I think the preventive part will keep getting added to it. And therefore, even on mental health, which is even more difficult problem to kind of feel, where we saw many startups, and if you see even platforms like Calm and Headspace, they eventually say it is for meditational. Even yoga, to some extent, you can say, hey, it is meditational. You get better sleep, you relax, and therefore you will have a better mental health. I think the consumers' understanding and association to understand that statement is very weak today, and therefore, unless somebody in your family is taking you to the center, right, or somebody, your loved one, is saying that, look, there is a serious problem. So Amaha is actually therefore solving that belly of that bracket of consumers who are actually suffering, and therefore as a result of that, the stickiness of the consumer. And eventually I think it will expand itself to people who can come in early, people who can be more preventive, and hopefully in the next 5 years the preventive part of it will grow, as more and more people become more aware. But it's a journey where between acute and light, that bucket will come together more closely.
Some of the businesses that you may have invested in would be having AI as an integral part of what they are doing.
Yeah.
And you've been into consumer businesses earlier. What do you think will be the future of consumer healthcare delivery, keeping in mind what AI is doing today? And also, AI, what we've touched upon, AI is just the tip of the iceberg. I mean, right now, AI is what we see is an augmented intelligence and not truly an artificial intelligence.
Yes.
But the future, there's a huge impact that it's going to have on the healthcare. What is your view on this?
Absolutely. And I think and now AI is also very, very loosely used and very poorly, kind of referenced, right? But I think that if there's one industry where true AI will play the maximum role, is healthcare, right? Because if you see where we are seeing early signs of success, is there is a system or a solution's ability to understand you as an individual. Because if there are 7-8 billion people in the world, each 7-8 billion is a unique atom, right? It's a unique individual with a very, very, very amazingly unique combination of different body vitals, markers, history, ethnical diversity, and so on and so forth. And the medical solutions eventually will actually become intelligent by knowing not only a class of people or ethnicity of people, or a certain skin type or a certain body type, but it is actually that individual. And that is where the role of AI will come in, where very, very hypothetically, it would actually map your genetical upbringing, to understand your gut, to your physical being, to your mental being, right? Understanding your context of your family, context of your financial condition, context of where you work, what you do, what's your lifestyle, and therefore what potential challenges you have. And that's already started to happen, right? You have platforms like Neura Health, right, which is a Fuji. Actually, Fuji has already invested in AI with their imaging technology, right, which is camera making, right, where it say, hey, if you are at an age X and your body vitals are ABCD, then based on heuristic, this is what you are more likely to have in 20 years from now, right? I think that is the future of real tech-led health, where on one hand, of course, there will be continuous innovation on molecule level, on different medical science transformation. I think that's, of course, the more scientific part of it, bioscience part of it. But when bioscience meets AI, right, which contextualizes bioscience to one individual, and therefore a solution becomes relevant only for you, right? Then that is the future of future of medicine, future of health, because then nobody would say, hey, here is a medicine for cold. It'll say, here is a medicine for cold for you, right? I think that's the that's the change, I think, and we are already seeing it happening.
Of healthcare delivery today, because personalization is the way forward. And also, what has interestingly happened post pandemic is, while you look at telemedicine and teleconsultations, these technologies have been there existing for over a decade. Right. But the adoption of these technologies suddenly took off post pandemic. I mean, even the old doctors who otherwise restricted themselves to feature phones have started using modern phones to access, radiology, etc.
Yeah.
But Dipanjan, my next question to you is, as an investment firm, you're working with different companies within the healthcare domain. Now, each of these companies may be having certain strengths which are missing in the other companies, or they could have common customer base.
Correct.
How does collaboration and partnerships are they driven to create that culture of innovation within healthcare between the different companies as a part of your portfolio?
Yeah, no, again, a very, very relevant question, Harbinder. And to be honest, I think we are still learning about it. I don't think we can say that we have understood. And I'll give an example just to contextualize what you just said, right? So if you see, one of the big barriers of growth for some of these consumer health companies or companies we meet is actually a question on the dependency on doctors, right? And the call it the doctor channel, right? Now the equivalent of that in the consumer industry is disrupted by distribution channels, or so the expert channel, as you call it, right? That equivalent democratization and disruption has not happened in the consumer health space, right? I will give an example. We recently met a very interesting innovative pain management company, solving for different aspects of devices and products for health. And the big question was, okay, hey, but to be successful, and these are all deep solutions, right? As I told you that we are talking about acute health solutions. You need a recommendation from a doctor, you need a physiotherapist, you need some validation of the claims. Now that ecosystem of validation, trust, doctor support, it's an unknown area today on how that will help. There is inherent conflict sitting into the ecosystem. There is no transparent way of doctors advertising for certain products, or is it advertising, or is it recommending? There are a lot of medical, there are a lot of regulatory challenges around that. So I think that ecosystem, what we are trying to kind of get an understanding of and strengthen, is that what is the right distribution and the reach mechanism for a consumer health company, which can then help the consumer to take a decision better. See, today that ecosystem is not very robust and not built out well. In US, it is built out by virtue of laws, HIPAA, by virtue of what you can say, what you can't say, but the digital infrastructure is ready. Right, but today I think that ecosystem is not ready in India, and that is the hope that in the next 5 years, maybe with a lot of digitization of records, right, what ABHA is doing, maybe it is where hospitals share information across a patient across platforms, where there is transparency of ingredients, there is a transparency of where a particular solution is crafted or made of. So transparency, understanding of the problem, getting medical professionals and experts onto digital platforms, like as you said, like something like Practo can be a platform tomorrow which actually bridges this gap. But that was not the use case of Practo maybe in the past, but this can become a use case today. I think that is the ecosystem which is work in progress. And without it, the scale of the growth of these companies would be slower. But this is something which we need to, as a must-have, solve it.
And at Dipanjan, I remember you just used the word regulation. And regulation and compliance are very, very critical factors when it comes to the healthcare industry.
Yes.
And, and India, if you look at the traditional pharma industry also, we have not done a great job on R&D to create products coming out of India. We back engineer and, we become a manufacturing base, but there's not much of innovation that has resulted out of the R&D efforts.
Right.
If you look at the startups as well, and in startups, if you look at the medical devices, etc., while they have a great thought in their mind, they typically miss out on having the doctor, the actual user, yes, involved in the process from the very beginning, which is why they struggle with getting getting past the regulation and compliance hurdles. And so how do you navigate through regulatory challenges when you invest in companies, or how do you even look at companies? Does regulation and compliance be a very large part of your thought process when you're investing in such companies?
Yeah, it is actually, and in fact, we recently invested in this company called Inito, right, which is a medical device company in the fertility tracking space, right, but sells in the US. Now, of course, there are various levers we see in terms of use case, consumer, repeats, and so on and so forth. It's solution, but our validation also comes from if they come back and say, "Hey, I'm FDA approved." Right. So today, so they are an FDA approved product, which is a certain gold standard, for a fund. We are not doctors, we are not healthcare experts, right? We are looking at the space of consumer health and can we democratize consumer health in a large way. So our reliance would also be on experts. And if you say I'm FDA approved, I mean, that doesn't mean 100% of everything, but it actually means a lot in terms of a certain bar being raised. Now, India doesn't have the equivalent of bar of FDA approved, right? There are many different regulations, and even FSSAI in the food industry is a quasi bar, right? But it is still a certain measure to say, you have to pass a certain test. I think we need to develop those markers to say, hey, if it is FDA approved equivalent or whatever it is, which means there's a certain amount of clinical trials, certain amount of tests, certain amount of testing on consumer. You can't take the consumer for granted, right? You cannot pop a pill and fall sick, right? It's a disaster, right? So no, US has consumers in the US are valued, right? And therefore you have you have those regulations, right? I think we need to come up with that, and therefore we feel that the level of innovation in which we will be able to invest right, is going to be more and more if there are agencies like these, who are saying, hey, I'm certifying for that. In the absence of that, there is no certification body today. So it is an important part of our evaluation. And even important part to your question on the maturity of this industry. Otherwise, we will remain like those little fringe innovation, right? There's OTC type, like little bit here and there. I think but the gap is really not there. The gap is really where the innovation is deeper.
Correct. And the Dipanjan, we've spent a lot of time with startups. All of us have been into various conferences talking about the startup culture, etc. And one of the questions that was always brought up in every conference was that how do you choose which company you would want to invest in? And the answer, typically, the first thing that came up always was that we look at the founder, because ideas are plenty, but execution is the key. We've heard all of this. But when it comes to healthcare investments, how do you choose the founder that you would want to work with? Does having a medical professional, a doctor on board as a co-founder, make it more attractive as an investment opportunity, or it's okay for an engineer to come up with medical solutions and offer it into the market? What is your view as Fireside Ventures as to what is it that you give importance to?
Yeah. See, again, a great question. And I think literally you're asking our playbook one by one, which is very, very insightful. So I think it's a combination of both. Our learning is that for a space like consumer health or healthcare, it needs an expert, right? And whether should be a co-founder, whether it should be a very senior member of the team, I think that is less important. But you need somebody who holds the solution and who owns the product, right? Now, the inherent challenge of that is that if it is somebody who is deep into research, science, or whether you're a doctor or not, then the capability that individual brings is innovation. And it's again the classic left brain, right brain kind of a question that, some of those entrepreneurs are not the classic GTM growth, business builders, right? And a lot of those entrepreneurs don't even want to do that, right? They actually actively say, hey, my passion is in, this innovation, but I need a co-founder who can actually scale this business, right? Who takes to the market. So I think we look for a combination of both, right? So to be very precise, if you find a great innovator, and amazing scientist, right, who is kind of found the next, let's say, breakthrough in a certain history, and that's it, right? I'm not sure that's a very investable founder, because then the business building block of it, where to market, what's the pricing, how do you build teams, will you be able to attract talent across different different disciplines? I think that's a big question mark. So we look for that combination, right? So like in Gynoveda's case, is a beautiful combination, and there are 3 co-founders. So Dr. Aarti comes is a Ayurvedic gynecologist. Like, so she's a doctor, she understands women hygiene, health, and he understands Ayurveda. So she is the soul and the creator of products and solutions. But then you have Vishal and Rajna, who are business builders, who are building teams, so I think that is a combination which is ideal. And this combination is generally true for all businesses in consumer, but it is significantly more important in a innovation-led company, than any other company.
And Dipanjan, my last question to you is that looking ahead, what are some of the predictions for the future of consumer healthcare, and how do you envision Fireside Ventures continuing to lead and also create that culture of innovation within the companies that you look at?
Yeah. So I think, as I started off with, Harbinder, we are very excited in this space, not only at the size of it, but just there are so many white spaces, right? It sounds, or we feel we are in the same spot today as Fireside was in 2017 when we looked at consumer itself, right? Where, middle of the last decade, 2015, 2017, you'll see, hey, this is this young Indian, aspiring Indian middle class, which is getting formed, where there are no consumer brands, whether it's a natural brand, whether it is a healthy food, whether it is fashion, lifestyle, they look like they're like hundreds of white spaces, right? And it is about good entrepreneur who can come and build. And the right to win in some of those business was innovation, but it was also brand, it was also access, it was also a lot of other things, right? Fast forward, today and looking at 2030, GDP per capita and GDP per capita in richer, affluent cities and states, which is maybe $4,000, $5,000, $6,000. I think the spend as a percentage of GDP for those cities and those states, and that, we call it the India one, if you will, which is, let's say, household income of more than 15-20 lakhs annually. The spend will rise very much, but the bar of innovation is very high. And therefore, what we are doing is we are doing a lot of thematic study. We are a lot of doing thesis study. We are speaking to consumer to understand really what the missing gaps are and what are the form factors and innovation is required to bridge that gap, right? So if it is something like sleep, right, of course, there are many solutions to it, but we are going deep into the understanding of sleep disorders and say, what is it? It is caused by stress. Is it caused by, your lifestyle? It is caused by your situation in life. So what is really the cause and effect, and solutions for that cause and effect is really going to work. So we are trying to go one level deeper in those consumer insights. We are trying to understand what is the innovation actually which is missing. And then when we meet founders and when we talk to different, entrepreneurs, we see the gap and we see that innovation being matched. And the good news is that we are meeting so many of them, right? That gives me that, the joy of, or the inspiration to say that this is just not a thesis. This is just not really something we desire to do. This is something which is happening on ground. We are meeting exciting entrepreneurs who are challenging the status quo, filing patents, talking about winning in the world, not winning in India. We are hearing this audacious, ambitious language, which is saying why we can't be a medical device business from India to the world, right? And I think that gives us that inspiration to say that in 5-7 years, it will be a very, very dynamic place and space.
Absolutely. I think the conversation today, I completely agree with you, is around creating products in India for the world. Yes. So I think that's where we are headed. Dipanjan, thank you so much for the conversation. One of the big takeaways, in fact, I just noted it down when you said that the biosense, when it meets AI, it will create personalization, and that is the future of the healthcare industry. And that's where, if you look at India, we have produced the best doctors in the world, and we have also produced the best engineers in the world.
Absolutely.
We are just in the right space right now and the right time to create what could transform the world. So Dipanjan, thank you so much for taking our time to speak with us this morning.
No, thank you so much. Wonderful and great questions, and hope this is helpful, and we all hope that the future is bright for the health industry in India.
Absolutely.